Good morning. We've got Dr. Rehm back for another cosmetic close-up. Dr. Rehm, in our cosmetic corner, I feel like a lot of patients are always asking me, what does an abdominoplasty consist of? Like, how does that work?
Yeah, it's a common consult that we get. So abdominoplasty is also known as a tummy tuck. That's a procedure where in the operating room we're going to make an incision along the lower part of the abdomen, really low, really beneath the bikini line, but it goes from about hip to hip. We're able to elevate the skin off the muscles of the abdominal wall and then and pull that tighter. So essentially any loose skin, stretch marks that are about the belly button level or lower, we're going to be able to pull down and excise that skin and tighten up the skin of the abdomen. So it takes care of the pooch of the abdomen. Because frequently people that undergo this procedure have laxity of the muscles underneath. Maybe they've been pregnant, and those muscles, the rectus muscles, the muscles that make the six-pack, have kind of stretched apart. And while we have that skin up and elevated, before we pull it down and excise it, we're able to sew up those muscles in the midline. So we tighten up the framework beneath the skin, so flattens the abdomen, and then we can pull that skin down and excise all the excess skin. So it gives a much flatter abdomen, gets rid of the abdominal pooch, gets rid of the excess skin and of the lower abdomen and fat that's underneath the skin. So it tightens that up and flattens it out. At the end, we end up with an incision that's along the lower abdomen, and then we have a little incision around the umbilicus, the belly button, that all that heals really nicely, and we do things post-operatively for scar care and so forth that help improve that. So most of the scar is hidden by anything that people would wear.
Awesome. All right, Dr. Rehm, so I know you said this happens in the operating room. What does that look like in the operating room?
All right, so we do these patients in the office operating room. You're under an anesthesia, sedation anesthesia, so the patients are asleep, but breathing on their own, comfortable. There's also some pain medication. It takes about 2.5 or 3 hours to do. Once we're done, we usually have a couple of drains in the lower abdomen that the patients are taught how to take care of, and those can be in anywhere from a few days to a couple of weeks depending on the output. We do inject a lot of local anesthetic in the soft tissue and even in the muscles, so that helps with post-operative pain control. But patients typically go home with some oral pain medication, some medication for nausea or vomiting, and then some antibiotics. The dressings that we apply are pretty simple. Gauze over the abdomen, and then an abdominal binder, which is essentially a big wide ace wrap with Velcro that they can tighten up, and we ask them to wear that pretty much all the time for the first 3 to 4 weeks following surgery to help the edema, the swelling of the tissue resolve.
Awesome. All right, and I know another hot question with most any surgery is what's my downtime look like?
Right, so abdominoplasty is a big operation. People are pretty sore afterwards, but they go home the same day. We have patients up, moving, walking the day of surgery. It helps with prevent any blood pooling or blood clots in the legs, and gets them to take deep breaths and open up those lung spaces.
Nice.
So you're up moving around the first day of surgery, but it's pretty sore. We ask patients to have that abdominal binder on for about a month. Limit the physical activity as far as any core lifting, pushing, or pulling for about a month or a month to 6 weeks. And at that point, they can begin to ramp up. People who need to do some aerobic exercise, after the first couple of weeks, they can start doing some neighborhood walking and things like that for exercise and to get out. But really, your downtime is month to 6 weeks for heavy lifting, pushing, and pulling.
Awesome. Cool. Well, I learned a lot about abdominoplasties today. Dr. Rehm, as always, thanks for coming and answering all of our burning questions.
Anytime.
Yeah.
If y'all have further questions, give us a call at the office and make an appointment, and we'll discuss further and get into more details.